Namaskar, good evening. This is Dr. Kaushik. I'm from Excelcare Hospital. I'm a consultant surgeon in the Department of Surgery. I'll be today speaking on common surgical causes of pain abdomen. I'd just like to say that the abdomen between the chest and the hip bone, it's like a huge cavity containing various organs. The pain in the abdomen can be because of any things going wrong with any of the organs inside the abdomen. I'd just like to tell you that our petor bhitorot beleg ongo thake, beleg organs thake. In the upper part of the abdomen, our beleg dhornor organs ase, for example, liver to ase, gallbladder ase just below the liver. Then we have got the stomach, and on the left side we have got the spleen. Just below and back of the stomach we have got the pancreas. So anything going wrong with any of these organs can manifest as pain in the abdomen. If we come to the middle part of the abdomen, we have got the kidneys on both the sides with the ureters coming down. Then we have got the small intestines in the center of the abdomen, and along the side of the small intestine we have got the large intestine. So if there is anything going wrong in any of these organs, again they can manifest as pain in the abdomen. And similarly, in the lower part of the abdomen we have got the appendix, we have got the urinary bladder, the rectum, and in females there is the uterus and the ovaries. So I guess the causes of pain in abdomen can be varied, and we have to properly diagnose the patient before we can come and find out the cause of the pain inside the abdomen. In our practice, the commonest cause of pain in the abdomen, like the amount of surgical patients I get, out of all of them, the most common till now, it's basically because of gallbladder diseases. So the gallbladder is a small organ just in the lower part of the right part of the liver, and the main function of the gallbladder is basically to store bile and concentrate bile. So as we all know, bile, it's basically pitta in Assamese, which is secreted from the liver. Liverer pora bile to utpadon hoy aru hi tololoike nami ahe, ahi pelai gallbladder ই accumulate হৈ পেলাই তাতে concentrated formত থাকে. আমি যেতিয়া মুখেৰে খাদ্যটো খাওঁ, খাদ্যটো যেতিয়া আমাৰ ইন্টেষ্টাইনলৈকে আহে, নাড়ীলৈকে আহে, তেতিয়া গলব্লাডাৰটো বাইলটো ৰিলিজ কৰে আৰু বাইলটো গৈ পেলাই খাদ্যৰ লগত মিক্স হৈ পেলাই হজম কৰিবলৈ help করে. So basically the function of the bile inside the gallbladder, it's basically to digest food inside the intestine. So things can go wrong with the gallbladder, and the commonest problem that we face in gallbladder disease is stones in the gallbladder. So gallbladder bhitorot jetia pathor hoy, the commonest cause or the commonest manifestation, the commonest manifestation can be simple dyspepsia and flatulence. Gasor bhav eta hoi thake, jar karonot patiente bhalke khabo nware, okoman khwar pisote petto phuli uthar nisina hoy aru tekhete bhalke khabole nware. That is called flatulence. And most of the patients, besibhag patiente bhabe etu basically gastritis problem boli bhabe, so they basically go to the pharmacies and take medicines for gastritis, which relieves their pain for a short time, but the main cause or the main disease causing the gaseous distension of the stomach is not diagnosed, and as such the problem keeps on growing and the patient suffers from time to time. So I would like to remind you all, everybody having any problem with their digestion, having gaseous bloating of the stomach, should go to a doctor, and the minimum investigation that has to be done is an ultrasound, which can be done in every nook and corner of the state. And basically, if there is any problem in the gallbladder, that can be diagnosed and the patient can be treated. So apart from flatulence and dyspepsia, what are the other problems that can happen in a gallbladder disease? The most important and the most common manifestation of stones inside the gallbladder is pain. Gallbladder is basically a pear-shaped organ. Gallbladder to eta horu eta balloonor nisina bostu, mukhon horu kintu gato dangor. So when there is stone inside the gallbladder, the stone might not be able to come out, so it gets stuck in the neck of the gallbladder, that is the opening of the gallbladder, and as a result of that, the bile cannot flow out and the patient has obstruction leading to pain. And because of the stagnant bile inside the gallbladder, it after a certain amount of time can get infected, and as a result of which the patient develops the gallbladder bile can become infective, and there is pus formation inside the gallbladder, which can lead to a condition called empyema. And then if the condition still persists, it can lead to gangrene of the gallbladder, further leading to perforation, and in a very few patients he can keep on suffering, and at the end he can develop carcinoma of the gallbladder, which is cancer of the gallbladder. Although it's rare, but it can happen in some percentage of the patient. So if by any chance the stone happens to come out of the gallbladder and go to the common bile duct, that is the main duct carrying bile from the gallbladder to the intestine, so what can happen then? The stone can get it can obstruct the common bile duct, and that can lead to jaundice. It can lead to cholangitis, and it can also lead to a very dreaded complication called pancreatitis, which can be very fatal at times. So we have to be very careful with gallbladder diseases and get it diagnosed at the earliest and get it treated. So suppose a patient comes to me with a gallbladder disease. What are the things I ask him to do? If the patient is symptomatic and is suffering from a long time, then the only treatment for gallbladder disease is surgery, because there is no medicine treatment for gallstones, and at one point of time, if the patient is not getting relieved of his symptoms, he has to undergo surgery at the earliest, because if he doesn't, then he lands up with complications, and complications can be very serious at times. And coming to the treatment of gallstone diseases, what are different modalities of treatment? So as I said, surgery is the main modality of treatment. There are two different kinds of surgeries for gallbladder diseases. We can either do a open surgery, or we can opt for a laparoscopic surgery. In these days, we basically 95% of the patients we perform laparoscopic surgeries, and in a very complicated 5% patients where laparoscopic surgeries might not be suitable for the patients, we take them up for open surgery. So the surgery is basically we go into the abdominal cavity, we inspect the area of the gallbladder, we try to separate the gallbladder away from the liver and the surrounding organs, and finally take it out. That is the basic surgery. So people often ask me, what are the advantages of a laparoscopic surgery over an open surgery? So what we do, in an open surgery, we cut the abdomen. We open up about 6 to 7 centimeters of the abdomen in the right upper part of the abdomen and go into the abdomen and try to take out the gallbladder. So basically, incision of 6 to 7 centimeter takes time to heal, and it is also a painful procedure. Whereas in laparoscopic surgery, we do not open up the abdomen as such. We just make 3 or 4 holes into the abdominal cavity, and we put in some small long instruments called laparoscopic instruments, go into the abdominal cavity and try to dissect out the gallbladder from inside the abdomen. So since we are making small holes into the abdomen, the pain associated with this surgery is much less. The healing is faster. The patient gets back to their normal routine life in a very short interval of time, and so the patient comfort level is much better than a patient undergoing open surgery. Plus, the other advantages of laparoscopic surgeries are that when we put in the telescope into the abdomen, we can inspect the whole of the abdomen, because we can turn the telescope from one side to the other, and even though our area of focus is in the area of the gallbladder, we can also see below the abdomen, in the sides, in the left side, and if there are any other associated problems, we can detect those, and we can do more than one surgeries if required at the same time. But in an open surgery, what happens, we just cut open the area at the level of the gallbladder, so we cannot inspect the other areas properly. Moreover, in a laparoscopic surgery, the magnification, we get added magnification and a much detailed view, because of which we can do a more precise surgery. And in cases where the gallbladder is badly stuck up, the areas that can be difficult to dissect in open surgeries can be more comfortably dissected in a laparoscopic surgery, because the vision is much better because of the magnification, and also we can have a look from different angles. Plus, as I told you, the recovery rate is much faster. In fact, if I perform a laparoscopic surgery on a patient, say today, in the evening the patient can get up from the bed, go to the toilet, and say 4 to 5 hours after the surgery we can start with liquid food. So the recovery rate is very fast, and the scars associated with the operation is also much smaller. But in an open surgery, again, the scar is a big one. There is more chance of wound infection. There is more chances of wound dehiscence. That means there is more chances of the wound opening up or a hernia developing later on in life. So definitely I would suggest that a laparoscopic surgery, which is the gold standard in today's world, should be opted for until and unless there is any other contraindication. Moreover, a patient coming to us for surgical treatment of a gallbladder disease, what are the things he has to do in the preoperative time? If he is a patient with heart disease, if he is on any antiplatelet like aspirin or clopidogrel, we ask him to stop the medicines 5 days before the surgery, so that the effect of the blood thinner goes down and the surgery can be done without any problems. If he is a diabetic, he needs to go to an endocrinologist and control his blood sugar, so that the blood sugar control during the intraoperative and postoperative period is better. So these are the basic things which we do in a patient with gallbladder stones, and it has become a very common operation in today's surgical work, and I guess that people should not hesitate to come to the doctor and get himself investigated if he is having any problem with flatulence and pain in the upper abdomen, because if the patient is ignorant of his disease, if he is not getting properly diagnosed, then the problem becomes chronic and it can lead to complications which can be disastrous in the long term. And moreover, other than gallbladder diseases, the other common surgical diseases that are seen in today's practice, which are very common, are appendicitis, hernia, and basically appendicitis happens when there is infection in the appendix. So appendix is basically a tubular structure which is attached to the large intestine. The part of the large intestine where the appendix is fixed is called the cecum. The appendix is closed at one end and it's open at the other end. So the most important causative factor in appendicitis is a fecolate, that is a hard inspissated fecal matter goes and blocks the opening of the appendix, because of which there is accumulation of collection in the distal part of the appendix, and that can lead to infection, that can lead to stoppage of the proper blood circulation in the appendix, that can lead to ischemia, and that can lead to gangrene. Once gangrene sets in, the patient can have perforation, the contents of the appendix can come out of the appendix, and it can form localized abscess, it can lead to generalized peritonitis, it can lead to sepsis. Those are all dreaded complications. So again, a patient suffering from appendicitis should not take it lightly, should consult a surgeon, and if required should undergo a surgery at the earliest, because again, the surgery that we do in an appendicitis is always mostly laparoscopic surgery, and I guess, as I already told you, laparoscopic surgery, the patient just needs to come to the hospital, stay for mostly 1 day, 24 hours. If at all, if he has got infection, then we prolong the stay up to 2 days. So in that period of time, the patient is relieved of the problem, he is treated, and he can go home and start his normal activities. Thank you. Okay, questions. So I've got a few questions and I'd like to answer to them. So how to differentiate between different types of abdominal pain? So according to the situation of different organs inside the abdomen, we can get a vague idea about the organs involved by the disease. Then we have got some supporting investigations which can be done. For example, the blood test. We can do ultrasonography. If the ultrasonography is not conclusive, then we can go for a CT scan or an MRI of the abdomen. So a basic thorough clinical examination of the patient and basic investigation like ultrasonography of the abdomen will usually give us the proper diagnosis. So the next question is, what are the causes of hernia? Is surgery always necessary? Okay, so let me tell you what happens in a hernia. As I told you, the abdomen it's like a big box which contains different organs inside. If there is any weakness in the wall of the abdomen, a part of the organs lying inside the abdomen can just be pushed outside, and that condition is called hernia. The commonest organ which usually herniates or which gets pushed out from the abdominal wall through a weakness in the muscle is the intestine. So as the question asks me that is surgery always necessary, I would say there is a chance, a big chance, by which part of the organ which has herniated outside, that is say the part of the intestine which gets pushed out, can get squeezed. If there is squeezing, that leads to obstruction or intestinal obstruction, because of which the food getting into the intestine cannot move down, and that is a condition called intestinal obstruction. From intestinal obstruction, a patient can develop a strangulated hernia, wherein the blood supply to that part of the intestine can be cut off. Once the blood supply to that part of the intestine is cut off, it can get gangrenous, and that part of the intestine can die off, and that is a grave condition, and the patient will have problems which will land him up in the ICU. He can go into sepsis, and the problems keeps on increasing. So it's better to treat the hernia when the patient doesn't have much complications, so that he can go off home after a small surgery and he recovers fast. The third question is, what are the symptoms of pancreatitis? Is it very painful? What is the treatment modality, surgical or conservative? So first of all, let me tell you, pancreas is basically a gland in the upper part of the abdomen which secretes enzymes and hormones. So the symptom of pancreatitis, the commonest symptom of pancreatitis is severe pain. The pain is not mild to moderate, but it is a severe kind of a pain which is basically radiated to the back of the abdomen. The patient cannot lie still, he has to keep on tossing and turning in the bed, and he is not easily relieved, and a pancreatitis can become very serious if not treated immediately. So yes, it is very painful, and in the treatment modality, usually in most of the cases of pancreatitis, we opt for conservative treatment. There is no role of surgical treatment in the initial part of pancreatitis, so it's mostly conservative treatment. Next question, what are the preventions of abdominal pain? So in order to prevent abdominal pain, we have to have a very healthy lifestyle, and one of the commonest causes of abdominal pain is simple gastritis, which is because of increased acidity inside the stomach. So if we make it a habit not to take spicy food, not to take food that irritates the stomach, then usually we can avoid gastritis. Also, we have to take food in time, our lifestyle has to be healthy, and we should watch what we eat. If we don't, then we'll end up with problems. Apart from gastritis, as I said, there are many reasons for which we can get pancreatitis. The commonest reason being alcohol consumption. Again, a gallbladder stone can end up in pancreatitis. So basically, we have to be careful. And regarding gallbladder stone, again, we have to have a proper diet, and also we have to prevent infection from happening inside the abdomen, which can later on lead up to gallbladder stones. So it's basically a healthy lifestyle, a proper food habit, not having food at odd hours, trying to avoid spicy, irritant food which might not be well digested. So at the end of the day, if we maintain a very healthy lifestyle, we can to some extent prevent abdominal pain. Next question, What are the most common causes of abdominal pain? Again, as I told you, the commonest cause, it can be simple gastritis, it can be gallbladder stone, it can be pancreatitis, it can be gastroenteritis. That is a very common problem that we suffer from. We take something bad, basically food poisoning, that will lead to gastroenteritis, and we get pain abdomen. Even a viral gastroenteritis can happen when virus enters our gastrointestinal system. So basically, infection of the organs inside the body can lead to pain inside the abdomen. The next question is size of gallstones when surgery is required. This basically is a very interesting question, because the common notion is the bigger the size of the stone, the more dangerous they are. But I'll tell you one thing, I had mentioned previously that there is a chance of a gallstone coming out of the gallbladder and leading to jaundice or pancreatitis. And as I told you, a pancreatitis is a very, very fatal disease, and that has to be avoided at all times. So for a stone to slip out of the gallbladder and go into the bile duct, it has to be a small stone. So a small stone is equally dangerous when we compare the size of the stone. If it's a small stone, it can easily slip out of the gallbladder and lead to problems in the common bile duct and in the pancreas. If it is a big stone, it usually doesn't come out of the gallbladder, but it causes problems inside the gallbladder. For example, cholecystitis, empyema of the gallbladder, and as I told you, in very few patients, it can lead to cancer of the gallbladder. And the last question is, what are the symptoms of gallbladder stones? I had told it in the initial part of my talk that the mildest form of gallbladder stone is the flatulence and dyspepsia. Flatulence is basically the feeling of bloating. We take in food, and immediately after taking in some amount of food, we feel fullness of the abdomen. We feel that we can't eat anymore, although the amount of intake is very, very less. That is basically called flatulence, and associated with flatulence we can also have dyspepsia. These are the mildest form of gallbladder stone diseases, the symptoms. This, if we don't treat this properly, then this can lead to pain because of gallstones. It can lead to infection, whereby the infection can become spread to other organs. For example, the liver, it can go to the pancreatitis, it can go to the pancreas, causing pancreatitis. It can even cause involvement of the right side of the lung, and it can lead to generalized septicemia if the gallbladder stones are not treated in time. So like as I told you, it can start with simple gaseous distension of the stomach, and it can lead to fatal problems like pancreatitis. So I guess that's all for today. These are the questions that were asked. So I hope I was able to clarify and clear your questions. So I would advise you to lead a healthy lifestyle, stay fit, and stay good. Thank you. Done.